Hi, welcome to Rutgers School of Nursing, where we're discussing leadership principles. Today's topic, delegation. Now, before we dive into our simulated video, let's talk about what delegation is. Delegation is the process of a nurse assigning another person a nursing task or activity. Nurses generally assign these to UAPs, or unlicensed assisted personnel, but it doesn't always happen this way. And remember, just because you delegate a task to someone else doesn't mean that you aren't still responsible for the outcome. Today we'll be discussing delegation in a code scenario. In this scenario, your patient is having an anaphylactic reaction to medication that they received 30 minutes ago. A rapid response event is called due to the instability of the client, and the nurse leader is a novice nurse manager. On this team, we have one physician, one nurse practitioner, 2 staff RNs, and 1 nursing assistant. The client needs immediate intervention to treat unresponsiveness, profound hypotension, and treat the underlying cause. By the end of this simulated scenario, you should understand how to properly assign delegated tasks to the appropriate delegate, understand proper communication techniques while assigning tasks, and also understand the risks and benefits associated with delegation. Now that we have a better understanding, let's jump in.
This is my first rapid response scenario with a nurse leader, so I need to think back to my rules of delegation. Right person, right task, right time, right communication, and right supervision. I need someone to administer meds and gain IV access, so I can assign those tasks to my RN, Gary. I need someone else to assess the patient's airway and the overall status of the patient. I can assign that to the nurse practitioner, Juana, because they have higher overall assessment skills. The nursing assistant, Jesse, grabbed the crash cart for me. Will need them on standby just in case more supplies are needed. Lastly, I need someone to be a scribe and record all the events taking place, and luckily my RN Shauna is available to record the events happening.
Hello, Mr. Mouse. How you doing? Just check your IV. Mr. Mouse, can you hear me? Hello? Looks like he's not breathing. Let's stop the IV. Throw some oxygen on. Hey, can somebody come help me here?
Hey, you called for help? What's the problem?
Yeah, so I walked in my patient's room and he's unresponsive. He's not breathing. I put some oxygen on him. I think he might be having an anaphylactic
I'm gonna
shock.
call a rapid response. Jesse, get the code card.
I'm gonna go and get the code card.
All right, thank you.
Hi, I need a rapid response for room 777. Shauna, you will be my scribe for the rapid response. I need you to record all the events as they happen. Everyone, please be sure to use closed loop communication so we know the right person is completing the right task.
Nick, I record all events during the rapid response.
Juana, you'll be responsible for the assessment. I need you to assess the patient's airway and vital signs.
Nick, I will start by assessing the patient airway and vital signs.
Gary, you're responsible for administering the meds ordered by Dr. Sabin. Please make sure there's IV access on the patient.
Nick, I'll be administering medications administered by Dr. Saban, and I'll be checking IV access.
Jesse, thank you for getting the code card, but please stand by the door in case you need anything else.
I'll stand by in case anything else is.
Closed loop communication is an essential part of the communication in the healthcare field. During closed loop communication, the recipient acknowledges the information received. This ensures the sender knows the information was heard and received as intended. Closed loop communication is critical during rapid response and code situations because many tasks are assigned simultaneously and the patient condition is unstable, so there is no room for error in communication. By everyone doing their job and closing the communication loop, we can ensure that the patient had the best chance to recover.
Patient blood pressure is 70/55. Airway is currently intact with a slight swelling. The heart rate is currently 118. The patient oxygen saturation is 92% on 2-liter oxygen via nasal cannula.
So this patient is having an anaphylactic reaction due to antibiotics. Let's start administering 300 micrograms of epinephrine and 1,000 milliliter of normal saline bolus. Do we have IV access?
Looks like the IV access may be infiltrated. I could give EpiIM first and work on the IV access.
Yes, give EpiIM injection.
EpiIM administered at 11:08.
Juana, I need you to obtain another set of vitals.
Nick, I will recheck the vital signs.
I got IV access.
Blood pressure 70/55. Heart rate 117. And patient oxygen saturation is 91%.
Gary, please administer diphenhydramine 50 milligrams IV and start the IV bolus.
Administering diphenhydramine 50 milligrams IV and starting the IV bolus. Diphenhydramine administered. Alright, IV bolus is started.
Diphenhydramine 50 mgs IV administered and IV bolus started at 11:11.
Shauna, when can we give epi again?
The first dose of epi was given at 11:08. Epi can be given every 3 to 5 minutes. The first dose was given a little over 3 minutes ago.
Perfect. Gary, please administer another 300 micrograms of epi via IV push.
Administering another 300 milligrams of epi via IV push. Epi administered.
Epi administered at 11:12.
Anna, can you please obtain vitals and reassess the patient airway?
Yes, Nick, I can assist patient airway and vitals. Okay. Airway is patent but it's still very swollen. BP is 84/75, heart rate is 120, and oxygen saturation is 94%.
Nick, we need a nurse anesthetist or an anesthesiologist in this room in case we need to intubate.
Jesse, can you please page Dr. Morris and tell her that there's a possible patient intubation in room 777?
Okay, I'm gonna page Dr. Morris and talk to her about possible intubation for this patient, room 777.
When was the last epi given?
Last epi was given at 11:12. Free to give another dose.
Gary, please administer another 300 micrograms of epi via IV.
Alright. Administering another 300 micrograms of epi via IV. Alright, epi administered.
Epi administered at 11:15.
Juana, can you please reassess patient vitals and airway?
Yes, Nick, I can assist patient vitals and airway. Okay. Blood pressure is 102/80, airway patent swollen is reduced, heart rate is 120, and oxygen saturation is 96%.
Okay, everyone, great job. The patient is stabilized, but I do want vitals taken every 15 minutes for the next 2 hours.
Dr. Saban, this is my patient. I'll take vitals for the next 15 minutes every 2 hours and I'll continue to monitor the patient.
Great.
Welcome back. Let's check your knowledge. Do you understand how to apply the 5 delegation rights principle demonstrated in this video? Can you identify one person on the team who was delegated a task that completed it proficiently and within their scope of practice? Can you name the assertive and therapeutic communication techniques used in this scenario? What about alternatives that could be used in clinical settings to support, direct, supervise, and provide feedback to delegates? Do you understand how to provide patients quality care and a healthy work environment through delegation? What are some possible advantages and possible risks associated with delegation? Thanks for watching. Tune into Rutgers School of Nursing for any future videos on nursing leadership.